Hello, dear colleagues. How are you? Hello, my name is Mynzhylky Berdikhojayev. My colleague Davlet Suyembetov and the operating nurse Bakhat. This is a presidential national hospital in Almaty city, Kazakhstan country, Central Asian region. Video support from Videon KZ company, Evgeny Grishayev, anesthesiology team, anesthesiologist Alexander. Turker. Керек жоқ Turker. Бой, кіре саламыз. Не ашып бере салыңыз, екі набор. Okay, I'm asking for two. Yeah, I'm asking to give me the set of micro syringes. And we have a 7 French guiding through the 8 French sheaths, and yes, it's Fubuki 7 French, and through the Fubuki 7 French we will place a headway duo and Traxxas microwave. Okay. Yes, I asked for the set of micro catheters, and now gentleman, еркек кісі ғой, да? Gentleman, 59 years old, presented with the tinnitus, and last time we did the first treatment. It was a stenosis on the transverse sinus on the left side, and the knee occlusion, subocclusion of the sigmoid jugular junction on the left side, and the patient had a transverse sinus, lateral sinus dural fistula. And today we have some changes, and patient now noticed that the tinnitus is less. You can see the wall stent carotid, 9/30 in transversus, and the second stent in sigmoid jugular, and the stent is working, and the second stent also works. At the end of the first case, the stent in transverse sinus was looked like occluded, but now we can see it's still functioning, and there is some arterial supply from the right side, from meningeal and the tentorial branches here, mostly meningeal. Yeah. Okay, it could be meningeal supply from the right side, but it's not so significant. That's why we will go from the left side. Now you can see there is some branches from the vertebral artery. It's posterior meningeal branches, and they're also supplying the fistula territory. And this is a hole of the fistula. There is multiple holes, and yes, if you notice, patient has a arch bovine, and Davlet finally went with the Fubuki 7F, which is successful catheterization. And now you can see several holes here and here, stent here and stent here. And unfortunately, we have no René Chapeau balloons RC balloons for sinuses. That's why we will do selective catheterization and the embolization. Also, option number 2, it's possible to go through the venous part and try to find each of the venous collector and possible to embolize transvenously. But today we will go transarterial and we'll do it transarterially. Okay. Labbe vein is still retrograde drainage, and the occipital veins, temporal occipital veins also retrogradely draining to the deep venous system. It's a sign of venous hypertension, and this venous draining pattern is an indication to treat this AVM, arteriovenous fistula. The risk of possible intracranial hemorrhage is very high in such draining. It's not the type 1 fistula, it's still type 2-3 fistula, and now Davlet is pointed the guiding catheter in occipital artery. And we took a headway duo 156, and this part is going to the close to the labbe. That's why, first of all, we will go distally and we'll check what's happening here. And after that, we can choose the proper point of drainage. It's not the final treatment, that's why we will work step by step, as those vessels are also effective, and we can close here, but here also the shunt, and this one is also going somewhere here. Let's see. Okay, еш нәрсе қимылдамады ғой, да? Мынаны референт қылып қоя аламыз ба? Смарт маска. Так, no traverse, пока что не. Okay, I will take my duo from the lateral connector. Usually we use 2 Y connectors, 2 or 3. Through the Fubuki it's possible to send 3 micro catheters if one is a headway duo. Then the others could be balloon and or sonic, or 2 sonic and 1 headway duo. It usually works like this. Okay, let's start. Так, промывка на острослых сразу восстановит. Промывочная система на острослых. Она на остро басқасына тығып жібере салшы. Yes, in the morning I thought about only 1 patient, but finally there are 3. And the patient number 1 finished with the diagnostic angio. And this is a patient number. The second patient was with the... Okay, we need to change the flushing system. Unfortunately, in the country only a volume of saline available. Only volume of saline available is 500 cc. It's a problem in the region. Okay, I put the Fubuki distally. I think like this may be okay, or like this. Yes, we put a zoom Yes, physical zoom usually much more better. Yes, we can push the guiding catheter as much as distal to do catheterization of the fistula point. Okay, it's quite distal. It's extracranial circulation, that's why sometimes it may look quite aggressive, but in extracranial circulation we can do it much more active about scaring of rupture something. It's a soft tissue and usually it's okay. Kontrast Josef. Okay. We're distal in the occipital artery. Наркоз поглубже, дексаметазон 12. I'm asking for the deeper general anesthesia and dexamethasone 12. Let's do it more like this. Then we can take it up and one more time, two more times up. Отлично. Yes, it looks like we are distal to the lesion, but there is a anastomosis to the skin branches. Total artery. It looks like it's an artery. Назад. Вперед. 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 Yes, you can see the stent in transverse sinus is also working. Okay, let's bring the microcatheter a little bit proximal, and then we can go again distal. I think this part is much more intracranial. Вперед, вперед, стоп. Ага. Назад. Назад. Yes, this point is mostly soft tissue. Okay, now let's check it quite proximally. Good. Okay. Let's do it from here. Вперед, 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 вперед. Yes, all drainage is coming to this. All drainage is trying to come to this point. This point. And I think we can go through this branch. Let's try to go from this branch. but it might be a little bit complicated because of the diameter difference. Huh? Okay, let's see. Yes, if Traxxas will not work, then we can change to Chikai Black. The beauty of using Headway Duo, it's possible to combine with any other 14 system wire, and in the department we have 14 wires. One is for Nero 14. One is Shikai Black, and the second is no, it's not going there. One is Shikai Black and the second is Traxxas. Yes, it's quite a big difference in diameter. That's why might be a problem to go there. Yes, usually those branches, it's easy to do catheterization with using balloon assistance. Okay. The first option, we can go with the Chikai Black. Okay, there is another branch. Yes, I know this branch. It's going to the proximal part of the shunt. Okay. Yes, it's going close to the vein of Lab Bay territory. Yes, this branch, in the middle. This branch, that's this branch. this. Let's, as much as possible distal. Okay. But this tortuosity, I think it's quite nice. Catheterization, huh? Okay. Nice. It's quite nice. Yes, it's quite close to the lab vein, but I think this point is also nice. We may control the lab and we can inject from here. Okay, let's start to inject from here. Yeah, unikers. Unikers. Okay, we will work with the squid 12. Yes, we already asked for dexamethasone and asked to do a bit deeper narcosis. It's a DMSO, dimethyl sulfoxide, and we injected half, and now we can inject the rest. Okay. Let's increase a little bit the radiation, and we can place the glue mode to inject the liquid embolic. Okay. I think there is a skin collaterals. Some muscle branch from the superficial temporal artery. It's collaterals coming, and now there is a collaterals from the internal carotid system. No, downward corridor. I think those branches. This is those branches. Just a second. Just a second. I need to take back the guiding to check the IC territory also. It looks like patient is moving, yeah?
Пациент двигается.
Пациент шевелится.
It's a problem with the general anesthesia. And I see this problem in many places, and it's not possible. It's not possible to work. На там откорисаш хеждинги жатки. Предыдущий ангион хеждинг. Последний. can see nothing. Yes, it's going forward. Шприц стал строго до Enter.
Дай 0,5 будет.
There is the collaterals. Okay, let's wait a little bit. Timer was all around.
Окей.
I think it's a reflux. There is some meningeal branches available. Non-bergeau. This is going to the collaterals. At one point it could be the branches from the posterior cerebral PCA territory or не көресіз задние мозговые территории. Задние мозговые территории себе көресіз? Я задний весь. Let's leave it in. И все это вот. Ах, это классно. Күйіп жүресің. Күйіп жүресің. Все хорошо. Онда қалдығын ана жіне бер. All these branches are collaterals. We should be very careful with the pyramidal part. This looks like reflux. Баспетрат. Стол до баспетрат. Not bad. I think our guiding in occipital artery, that's why we can see mostly the territory of occipital artery. Назад. Вперед. Назад.
Назад.
Okay. Let's continue. Так. Ага. There is also the reflux. Тағы бір соник талып дистальный кіре саламыз ба? Соник емес, нені headway 17 талып. Headway 2.
Сіз мына бетке кіргізіп тұрмын.
Алдындағы кірген.
Мына жақтағы ма? Мынаған кірмейсіз ба? Мына бет барып тұрған.
Қайсы?
Мыналар болып тұрған сияқты.
Кіру проблема шығар ол. Ана жерден кіреді.
Лучше мына жақтан кіре салайық та, жаңағы жерден. Мынадан кірейік. Кішкене потокын азайтайық.
Так, ну-ка назад берші ана. There is one more branch is coming from. No, it's a branch where we are. Headway дуо бересеш? Дуо. Тағы бір дуо. Соған жаңа кірмей қойды ғой. Аша берсін.
Дистальный кішкене.
Сол дистальный.
Дистальный кіріп бере бар.
Okay, we can wait
Проводник шықпа или осы жерден?
longer. Осы жерден.
Үшінші системаны қой.
Жоқ, жоқ. Кіре сал.
Если не урок күтеміз ба или спираль?
Жоқ, жоқ.
Поток азаяды ғой деген.
Yes, let's save the time and go distally. So headway duo number 2. We'll go to the previous territory. We already did angiography. Нені бересеш? Алдында родно тұрмыз. Кастратор бір жіберсің. Нені бересеш? Родно. Просто родно. Еще раз. Okay, let's inject a little bit before we will go distally. It's a meningeal territory. Yes, now it's a territory coming from the muscles. Okay, let's wait. Okay. Let's bring the grading up. To make the catheterization process easier. I think it's a branch. Yes, we need to go up and then it's going back. Okay, this part, and then here is the bifurcation. Huh? Okay, let's do Mynzhylky from here. Несін, салып қоя бересің, пластмасс. И таймерді қоясыз. Так. Стоп. Назад. Вперед. So it's directly going to the festival point. Okay. Проводник наверх. Родбол. Okay, Jason. Cheers. Роднаптанды роднап қоясың. Навигейтке қоясың. Смарт маска. Алдындағы анген смарт маска. Осыны смарт маска. Too much talk to it, yeah? Okay. I think it's not bad. It's too tortuous, that's why the device is not going proper direction, and this is going to the extra cranium. Okay. Let's do it from here. Назад. Стоп. Вперед. Вперед. Стоп. Вперед. Назад. Окей. Давай дымсу. И там да скрутим вперед. Обычно ровно. Глю. Окей. Дымсу. И сквит. Yes, now the medical company changed the syringes and it's a medallion syringe. And неден koyasır. Задний циркуляция, задний барвот контамурт. Koyasın. I think it's branches from occipital artery. There is a collateral scan. Engineer.
Bakın. Salma bak, hadi.
It might be reflux. No problem. Nice. There is still some branches going. Does it? Does it? No. Okay. There's one bigger branch from occipital artery. Does it appear? Yes, we have time. No problem. And the beauty of using headway door, and thanks to experience with the Aptura liquid embolic, now we can wait a bit longer than we used to wait with the squid. And after 5 minutes, we had experience of injection after 5 minutes, and now it's no problem to inject after waiting of 5 minutes, and it's usually okay. It's a second branch, we already have been there. Okay, there is a reflux, we need to wait a little bit. And also the reflux here. Okay, no problem. Okay, let's wait a bit. Yes, now I think the guardian and the extracranial carotid, external carotid artery, and we can check the meningeal territory also. Yes, it's much more better, and The second strategy to go step by step is also important. Вперед. Slab is intact. Назад. Вперед. Назад. 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 All drainages are coming to this point. Yes. I think it's important to reach that point and occlude it roadmap and occlude it fistula point from there. Yes, this branch is refluxing. Also there is some more part. Okay. Also we are going to the meningeal. That's not bad. Yes, it's not bad. But we need to be very careful with the middle meningeal territory. I don't need to occlude the branches going to the facial nerve. Okay. Okay. Let's wait a bit. Пока джетит. Наш шприц азай ватқан кез болсын. Okay, let's wait a bit. Maybe we can inject some demosol. Бересеш? Может, demosol жуйса. We can inject a little bit demosol, which could be very helpful. Yes, now the liquid embolic is also in the middle meningeal territory. It's refluxing and it's also going to the middle meningeal. Okay. Так, 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 так. It's a branch going to the soft tissue. Let's wait with this. Так, родно. Демос. Трансцентр. Ага. И она грязные несколько изысешь. Ониксные несколько изысешь. Отдохнешь. Oh, it's refluxing. It's not bad. Okay, I think we need to leave it 14, 16 till 19. I will not touch this till 19. Now, it's not bad. We can start to do this. Yes, let's start to go forward. I think it's the same territory which were before. Okay, let's check one more time. Бес мың гепарин сызар. Кетті ғой да гепарин? Okay, I'm asking for 5,000 units of heparin. In dural fistula cases, it's very important because we are dealing with the venous system, and it's part of prevention of the venous thrombosis. I think this branch or something from here it might go. Yeah. Yes. Yes, it's far more better than it was before. Some part of the meningeal we also took from this part, little part, not so much. We'll wait for another 2 minutes with this branch. And now we will continue to inject with the upper one. And it's look like the liquid embolic is coming, yeah? Now it's going to the territory we wanted to go. And reflex is as much as possible. Okay, let's wait for another couple of minutes. Бұл аспирин бірді мешур му?
Бұл плавикс шилдер.
A patient on clopidogrel?
Clopidogrel шилдер. И ксаролта шилдер.
On Xarelta. Okay. It's beautiful. Clopidogrel ішкені қанша уақыт болды? Қаш? Март? As the first session was in March, now it's July, 3 months. Okay. April, May, June, July, 3.5 months. Okay. Okay. Patient on Arixtra. Arixtra is a it's low molecular heparin. Okay. Now we're injecting from the first microcatheter. Yes, it's a bit refluxing. And also the some part in meningeal territory. There are small branches, small collaterals. It's a meningeal territory. Man squid пересол. Squid. think now the territory is a little bit risky. We need to check this one from the vertebral injection. Okay, it's the left vertebral. Yes, all is going like this, that's why. It's уник. Okay, let's change the syringes because they will prepare. Davlet will prepare the second syringe. Inject from this syringe. No problem. No, it's how it looks. Okay, let's wait. I think it's a collateral branch. Okay. Because, может быть, даже брахтом нет смысла говорить. Okay. Let's wait a little bit if there is a reflux. Maybe it's quite close to the time to finish the case. Huh? I think this is a branch we wanted to go. Yes, it's a branch we wanted to go. There are some small branches, but the branch complex to catheterize, now we occluded already. Болды. Yes, there is a small branches. Вперед. Назад. Yes, also we need to check the circulation from the vertebral artery. Okay, Rodma? Okay. Okay, let's wait with this syringe. Olni? Olni? Демсол? Уник, ну? Демсол. Ладно, сейчас на самом деле. It's a demosol. Okay. I think it's a time to stop, and now we can take out the we went out with the first microcatheter. Now, Rodno. I will inject a little bit with the second one. Okay. Let's take it out. Okay. Yes, with the intracranial circulation, it's not possible to do like this. But with extracranial, there is no problem. Okay. A small flow. Okay. Now we are in the external carotid territory. That's why. Like this. First of all, from the external carotid injection. I think there is no need to go today for this another branch, but yes. Yes. Now from the common carotid. Yes, the flow in lab A also not so high, and I think it's time to stop and CT angiography. Okay. First no. Okay, let's wait for the CT. This is the last case for today, and I will stay with you for another 3 minutes. Еще минуты 3. Dear colleagues, we had some issues with the control CT, but finally David can make it without problem. The brain is clear. It's very important. The back part looks like this. And let's do it again like this. Like this. And now we can see how much liquid embolic was subcutaneous. That's okay. This part is in the muscle. Usually it's no problem. Okay, dear colleagues, now we can finish the case. I wish you nice day. Maybe a couple of cases during the week we'll have. And thank you for watching. Have a good day. Bye bye. Bye bye.